Welcome back. So now in Inshort series, we'll be looking at the myocardial infarction. It's a very important topic. And now here, myocardial infarction, it is the most important coronary artery disease. And looking at the incidence, it is mainly in case of developed countries, it is mostly present. And it leads to accounts about 25% of the death. Okay, and now looking at some of the important factors which lead to this can be age. It can occur in variety of ages, but it is increases in case of elderly, it increases. And looking at the sex, it is mostly male dominant. So males are more prone to this than the females. And now moving on to etiopathogenesis, we can have this myocardial ischemia, that is diminished coronary blood flow or increased myocardial demand, and also the hypertrophy of the heart. Next, there is role of the platelets, that is it can lead to the aggregation, activation, and also the release. And next we have the plaque rupture, that is it can lead to superimposed coronary thrombosis as well as intramural hemorrhages can be present. Next we have atherosclerotic causes, that can include embolism, thrombotic disease, or trauma. We can have transmural infarcts, as well as subendocardial infarcts. And here important to note is transmural infarcts, it accounts to about 95% cases. Now moving ahead with the microscopy and some features which can be seen. And here within the first 6 hours, we can notice that there is some waviness in fibers. And moving ahead with less than 12 hours, we can notice neutrophilic infiltration as well as edema and hemorrhages can be present. Now moving ahead, if we look at less than 72 hours, we can look at the neutrophilic infiltration is more developed, increase in development. And moving ahead, if you look at the within 7 days, so here we can notice that there is absorption of necrosed fibers by macrophages. So we have the role of macrophages, and also this fibrovascular response is initiated. Now moving ahead with time, with the 10th day, in about the 10th day, what is noticed is there is the necrosed material is removed. It is removed, and the fibrovascular response is prominent, more prominent, as well as there is presence of pigmented macrophages, eosinophils, lymphocytes, plasma cells. And moving ahead, in the 14th day, what can be seen is complete removal of the necrosed material, and the neutrophil disappears. And moving ahead with the 3rd week, in the 3rd week we can notice that the necrosed material is removed, as well as there is increase in fibrocollagenic tissue. Then further, looking at 4th to 6th week, we can notice similar, that is increased fibrocollagen tissue, as well as there is decrease in macrophage, lymphocytes and the plasma cells. So we are done with the microscopic features. Now moving ahead, looking at the diagnosis. This is also quite important. In the diagnostic aspect, first we need to know the clinical features. So here we can have pain, indigestion, there can be apprehension, that is panic, and then there is shock, as well as oliguria, and also acute pulmonary edema. And another important aspect will be the ECG findings. Here there is increased ST elevation. There can also be T wave inversion and also wide Q wave. So in case of, if you are seeing the ECG, these points to be noted. Then there can also be cardiac markers. Important being, there can be CK, CKMB, as well as CKBB and CKMB. So here BB is brain and lungs, and MB is cardiac muscles as well as extracardiac tissue, and CKMB. So these are nothing but the forms. So the another one includes CKMM, that is from skeletal muscles. So 1, 2 and 3. Now moving ahead, complications are even more important. Under complication, there can be arrhythmias, there can be congestive heart failure, there can be cardiogenic shock, there can be mural thrombosis, as well as thromboembolism, and there can be rupture, cardiac aneurysms, pericarditis, as well as post-myocardial infarction syndrome. Thank you. I've tried to cover MI as short as possible. So thank you.